From the Detroit Free Press, it's Monday, October 26th. Here are today's top stories.
Presented by Bush's Fresh Food Market. Bush's has over 4,000 Michigan products, including the freshest fruit and vegetables, meat, seafood, and baked goods. Stop by one of Bush's 16 locations for the personal service you expect from your neighborhood grocer.
For the Detroit Free Press, I'm Kerry Jr. II. As Michigan sees its highest case numbers, state officials say distancing and masks are the best way to fight further spread until a vaccine is available. There are currently 4 vaccine trials taking place in Michigan, and Free Press reporter Kristen Jordan-Shamus has the updates on how they're going. Kristen, thank you for joining me.
Thanks for having me.
First off, there are a few different trials going on in Michigan. How many are there that are taking place?
So right now there are 4 vaccine trials underway at Michigan sites, but there have been some safety concerns with 2 of the vaccines, both AstraZeneca and Johnson & Johnson, which are both being run through the University of Michigan and Michigan Medicine. Those are both paused right now temporarily while investigators look at the safety concerns that came up in some of the people who are participating in the vaccine trials.
And so is this a typical process for vaccine trials?
There certainly are side effects sometimes that can be discovered during trials, and this is sort of part of the process. They want to pause it, they want to investigate it, they want to make sure that it's safe to keep going. What's interesting is the AstraZeneca trial has resumed in every country except for the United States. So this is a phase 3 trial that's happening around the world. And so it's not just in Michigan, it's the entire United States where the trial has been paused. And there are sites all over the U.S. that are hosting these trials. And the U.S. FDA decides when it may or may not resume. And there are no indications right now that the FDA is going to grant the okay for AstraZeneca to continue.
The trials that are ongoing, where are they in the development process?
Well, these are all in phase 3 clinical trials, and phase 3 is where they determine, are they safe and are they effective? So do these vaccines work and are they safe to give to people in mass quantities? And so right now, Pfizer is saying that everything is looking really, really good with their vaccine, and so is Moderna. And so at this point, Pfizer has said that it will probably request authorization for its vaccines from the FDA so they can start being used in the United States after the 3rd week in November. The CEO of Pfizer has made it real clear that the company won't seek authorization to use its vaccines until it is really sure that these vaccines are safe.
Once the vaccine has been tested and verified and they're ready to produce and distribute it, how will they distribute the vaccine?
So we know that there's probably going to be a big demand for the vaccine, and there isn't going to be a big enough supply, especially at first, to vaccinate everybody right away. In Michigan, the State Department of Health and Human Services released their plan for what would happen here in Michigan once a vaccine is green-lighted. So healthcare workers would be the first people in Michigan to get vaccinated under this plan. And then local health departments would get the remaining doses of the vaccine to distribute in their own communities. And then there would be a priority list for them as well. And that priority list would include first responders and people who live in nursing homes or long-term care facilities, people who work in those facilities, and folks who live in other congregate settings like prisons or jails, homeless shelters, people over the age of 65, and those with chronic health conditions. Once there's a bigger supply of the vaccine and it's more available, the state would then expand it to vaccinating grocery store workers and other people in essential positions. And then after that, then it would open up to the general public.
Thank you, Kristen, for taking the time to explain that to me and the listeners.
Thanks so much. Take care.
Here are the latest coronavirus numbers. The state reported just over 3,000 new cases of the coronavirus and 35 new deaths Saturday. 27 deaths were uncovered in a review of death certificates. As of Saturday, Michigan averaged over 1,800 cases and 25 deaths over a 7-day period. In total, health officials have reported over 158,000 COVID-19 cases and over 7,100 deaths statewide. That's the latest. For more information on COVID-19 in Michigan, visit www.freep.com.
I'm Kirkland Crawford with the Free Press Sports Department, recapping a wild end to the Lions game on Sunday. If there's one team in the NFL that is worse at keeping a lead than Detroit, it's the Falcons. Lucky for the Lions, they were in Atlanta yesterday. The Falcons seemed destined to boot a game-winning field goal, but alas, Todd Gurley scored a touchdown, accidentally might we add, to give Matthew Stafford and the Lions 64 seconds to try to answer. And they did just that. With no time left on the clock, Stafford hit T.J. Hawkinson for the game-tying TD. And despite a penalty after the play, Matt Prater nailed the longer-than-normal extra point for the win, improving the Lions to 3-3 on the season. Stafford had 340 yards passing, 114 of those to Kenny Golladay, who keeps on showing he should be paid like a number one wide receiver, whether that be here or somewhere else. Next up for the Lions, a home date with the Colts at Ford Field this Sunday.
For more stories from the Detroit Free Press, be sure to check out freep.com. That's FREEP.com. If you're a fan and want to support our quality local journalism, subscribe. Go to freep.com/special offer.